Welcome to Session 1, the initial consultation. These are the learning outcomes for this session. Session 1, initial consultation. Click on the tab, arrow forward. So here we've got our demographic data that's already been pre-recorded. We can continue from there. If that's not filled in, if it was the first session, you'd click on all the required information here simply by clicking the tabs or entering the date of birth and postcode. Arrow forward. From their consultation pack and the pre-questionnaires that they've filled in, you'll then score the DASS, the depression, anxiety and stress, simply by typing in their results. Once they've typed in, we'll move forward. We're then going to ask our patient about their current eating habits and how many serves of fruit that they may consume each day. If a patient isn't sure, or you're not sure yourself what a serve of fruit is, you click on this tab here and it will identify what a serve of fruit is. Just to be clear here, it's not one of each of those is one serve, it's an apple or a banana is one serve, 1 cup of tinned fruit, or 2 small pieces of fruit such as small apricots or plums, etc. To remove that off the screen, you just click on there. Same with serves of vegetables. So that resource is available, and then just simply record how many serves of vegetables that they eat per day. We also want to record how many cups of sugary drinks that your patient may have, either per day, per week or per month. So if it's per week and they have 3, we just enter that. We also want to know how often they eat takeaway food such as burgers, chips, pizzas, etc. And again, you can click never, per week or per month. In this instance, I've clicked per week and typed in 10. We then want to ask some questions about serving sizes. So we can click on, as an example, potato. We ask the patient when they eat potato what size serving they would normally have. A being half a potato. If it was less than half a potato, you'd click less than A. Same goes whether they have B or C or anywhere in between. So we just click so that we can record that, and we close it down. And we'll do the same with steak, which also is applicable to meats or chicken or fish, and we're just recording what size that they have there. Same with vegetables. The circle here is in relation to a large plate. And again, we could do this with casseroles or all-in-one meals such as stir fries, curries, etc. So just to record, to give us a baseline of the patient's current serving sizes. We also want to find out during the past week how many days they've cooked dinner at home, and then also on a scale of 1 to 10 being 1 not confident at all and 10 being completely confident, how confident they feel with preparing meals at home. After we've captured that, we move to the next page. From their questionnaire pack that they've filled out previously, we score their scores from the R18 3-factor eating survey. You'll notice if I put a high score in, that it will automatically red flag to consider a referral to a GP. So we enter the scores in there, whatever those scores might be, as an example. Then we move forward. From the 24-hour food diary or 24-hour food recall that they've completed prior to the session, we would then count them up, how many serves of fruit, how many serves of vegetables, how many serves of grain and cereals, and we enter that data in there. Meat and meat alternatives, dairy, water and discretionary foods. So we enter all those in the platform, and then that will populate into this chart. This chart will also pre-populate into session 3, where we would have a discussion with our patient about the results. So for today, being the initial consult, it's just about the data capture. We talk about this more in depth in a later session in session 3. So moving on, We ask some questions about physical activity, talking about vigorous activity where they've got their heart rate and their breath rate up significantly, and then we record how much they're doing that. We also want to find out how much sedentary activity they're participating in, and we click the appropriate button for that. And during the past week, we want to find out if this physical activity level's been more or less or about the same as usual, so you click the appropriate button. Just on that, while I'm speaking here, you can also get your patient to click these buttons and to, if they're literate and computer literate, to fill this out themselves if you wish. We're also finding out some information about their alcohol intake. We're not doing this from a kilojoule perspective, but rather to see if we, as they adopt a more healthier lifestyle, whether their alcohol consumption decreases. So fill that in just by clicking the tabs as per usual. We arrow forward. If your patient does experience pain, if they have some chronic pain, we'll get them to fill out this survey, because we know that losing weight can relate to a reduction in self-reported pain. So we'll fill that out. Down here, this is subjective pain scale, where 0 equals no pain at all and 10 is worst pain imaginable. So it's a subjective pain scale that you ask your patient to rate themselves. Then moving forward, this is where we weigh our patient. So we'll put them on the scales, weigh the patient. We also record their height on the first instance. We don't need to record their height anymore following the first consultation, but we need that on the first occasion so that this will calculate the BMI for us automatically. So we need the height there for that. We'll also do a waist circumference, just so you're clear on the way we recommend that you do the waist circumference measurement, is we'll do a measurement on any patient in the narrowest part of their waist you can find between the lower rib and the iliac crest. That remains consistent throughout. And you record their steps if they're using a pedometer or a Fitbit or a Garmin, or even if you can record it if they carry their mobile phones around them and also have that application. That'll be at each practice's discretion. Down here you'll notice a tab that says More Info. This information provides you and your patient the access to have a look at where they fit on a BMI chart and what's healthy and what's not. This can be a good resource just to show your patient of where they currently may sit and where they could aim to be to have a healthy BMI. Over here we've got our some information on waist measurements and what puts you at a high risk, low risk, or what isn't a good waist circumference. That's just a resource you can use with your patient at any time as well. So moving forward, so now we're going to inform our patients that we've got an avatar on the next page. So the avatar is a representation of what someone may look like with the same measurements. So obviously here it will default to the gender of the person. For the sake of this, I'll make it a female participant. We can look at we can change their body shape to suit what type of body shape, whether they're more rounded shape, whether they're more of a triangular or pear-shaped, or whether they're a straight up and down square shape type patient. In this instance, we'll make the patient a round body shape. Now the height will already be pre-populated from the previous page, as will their weight. Their age has also been pre-populated from what we entered at the start, and their body fat will automatically come up based on population health data averages. So a female of 170 centimetres tall, 99 kilograms at 29 years of age will statistically have a body fat of approximately 46%. So now we ask our patient if they would like to see a representation of someone who has those measurements, and if they agree to it, you would click here. So this is at the practitioner's discretion. So now we've got a representation of that person at that weight. We can do a few things here. We can fat and muscle adjust them. So if you had an athlete or a bodybuilder per se, you could adjust the fat and muscle up and down just by moving these tabs if you wished. We generally don't need to touch these two, but that option's there if you wish. But what we can do, however, we can change skin colour, we can change hair colour, we can change their hairstyle, whether they got short or long, just to make it more representative of the person. We can put them in a long sleeve shirt and workout shorts, or change their clothing if you want. Some of the patients find this a fun thing to do, so you can play around with that. Additionally, we can turn the patient around using these arrows here to show them what they look like at different angles. However, the most important part of this avatar is to show the patients that what they might look like if they reached their desired weight, or lost a few kilos, or got down to a healthy BMI. In this instance, I'll take the patient to a healthy BMI, and then we can show them what they may look like at a healthy BMI. This can be a very good motivator for your client. So what I'll do now, I'm just going to return this person to being not quite as healthy, because it'll give a better representation of the next graph. So moving forward, I then ask the patient a few more questions, whether they've been exercising lately in the last 6 months, the current health conditions, and a brief family history. When we move to the next page, we get our health risk graph. So in this particular scenario, it shows that our patient, Minnie Mouse, has got a very high chance of developing diabetes, heart disease, stroke and cancer. However, it also shows us that she's 29 years old but currently has a health age of 51. If we start the patient exercising, you'll notice we'll automatically get a slight reduction in our risk of developing chronic disease. We also get a slight reduction in the health age. Then, in this example, if we lower her blood pressure, either through medication or lifestyle or a combination of both, again you'll see that her likelihood of developing diabetes, heart disease, stroke and cancer has dropped again. And as has her health age. If we quit smoking, we get a significant decrease in likelihood of developing chronic disease again, as you'll see by the green on the graph dropping. More importantly, we know this person needs to lose at least 30 kilograms, so we'll take her down 30 more kilograms, and you'll notice now that her chances of developing diabetes, heart disease, stroke and cancer has dropped significantly to be in the low and minimal ranges. Additionally, her health age is now actually down below what her actual age is. This is quite motivating because people at 29 don't want to be told that they're 51 years old. Okay, after we've completed that, we move on. After we've completed the health risk graph, we continue on, and now we want to actually ask our patients to select some goals, or a goal I would recommend at this stage, not too many to begin with. We do have the capacity to set goals at any stage throughout the program. So you'd ask your patient to have a look at these goals and see if any of these goals may appeal to them. If none of those goals appeal to them, you can click Other and free text in this box, and that will record whatever goal it is. In this instance, let's just say that they'd like to improve portion control. So we'd simply click on Improve Portion Control and then move forward. We'd then ask them if they'd like to select a physical activity goal at this stage. They may not wish to. You don't have to set a goal for each, but if they would like to, you'd ask them to have a look at these examples and or click Another. So for the sake of here, I've clicked, this patient's clicked Other, and they've selected to start riding their bike. So I've free texted that in already. So their goal will be to start riding their bike. Once we've done that, we'd move forward and then ask if they'd like to select a lifestyle and goal. So in this instance, they've elected to buy new active wear. So we'll move on. So now we want to check if their goals are feasible. So this is a scale of 1 being not ready or not important or not confident or no understanding, to 10 meaning 100% ready, 100% important, 100% confident, and 100% understanding of it. So if your patient had selected a 2 here, as an example, you might want to break that goal down and suggest that how about we just improve portion control on 1 meal per day or 1 day per week. Then they might agree to that and say, yep, they feel a lot more ready to achieve that goal. Additionally, if they continually scored down here with their readiness, confidence or importance, that you might want to go back and select a new goal because it might not be achievable for them at this stage. So let's say we've agreed with our patient that they're happy to improve their portion control just 1 day per week. We'll click 8, and they've clicked that it's important to them, and they've clicked that they're confident that they can do it. If their score down here in the understanding is low, this isn't as big an issue, because what we can do at this stage is we can say, go home and have a look in the resources that we've sent you and read the section on how you could improve portion control. Let me know what you've learnt when you come back next week. So this one isn't as important because it's quite well resourced. However, we would like them to have a good understanding. So the better the understanding, the more likely they are to achieve that goal. So again, we get them to score on a scale of 1 to 10 with their physical goals, and we click the appropriate tabs, whatever they might select. Generally, you're looking at a score of 7 above for it to be a feasible goal. Then we go forward with the activewear. It looks like this person's got it pretty sorted on how to go about buying their activewear. So I'll feel confident that'll be a successful goal. We'll move forward. This comes to the end of the session now. We do have a report here, so you can review the report here. And that just simply contains the basic information that we've recorded so far. So it's got the date of the consult, their name, their steps, their weight, their height, and their waist circumference. That will plot out on the chart over the coming weeks, and also a score of their goals also. One thing that I recommend here, you can actually print this report, but I recommend for the patients just to take a photo of the screen on their smartphone so they can keep a record with them over the 12 weeks as well. So that's the end of session 1, our longest consult.